It started with just the sneezing and having incontinence of urine, laughing, coughing, all of those things that are just normal. That started after my children were born, and probably in my 20s, and up through about 45 when I actually started exercising and really got into trying to get healthy, and was finding that I was unable to get through even an hour of a workout without having to stop and go to the bathroom.
Problems like this are complex. There's sometimes an isolated issue with an isolated cause, and we can just address that with some sort of therapy, whether it be medicine or surgery or even physical therapy. But oftentimes it's complex with multiple things occurring, and we have to treat the multiple aspects of it.
I thought it was just normal. It didn't seem like that big of a deal. It didn't happen that often. But as I got older, it happened more often and it became more severe.
Many women will come to see their physician for another reason or a related reason, and in a discussion, they may volunteer the information that they're having some of these pelvic floor issues, but a lot of times they find them too embarrassing and they don't want to talk about it.
I had a menstrual cycle that lasted for 8 weeks, and I was done with that. So I went to see Dr. Rush for that. That's how I got hooked up with Dr. Rush, was I needed that fixed. And during my appointment, he had asked me, do you have any other concerns? And I thought, well, I'll go ahead and throw this out there. And so we started discussing that. And during that appointment is when he actually said, well, let's just do the test and let's see.
I said, there is something we can do about it. I need to sit down and talk with you and examine you, and we can talk about all those options, but that absolutely we can help you.
Dr. Rush is excellent about, finding out if it's a surgical issue or is it something you can do with just bladder training. There's other options if it's not always surgery, but, when it is something you can fix surgically, is that you look at those options and know that it's available.
We did some testing on her bladder that's done in the office to see exactly how it functions. We do a bladder diary to see how her bladder is for her in regular life, and this helps guide some of our treatment decisions and processes. But within that, once we had that information, based upon our symptoms, we talked briefly about some medicines that might help, see if physical therapy was an option, but ultimately, Janelle decided on surgery, which for her was a very good choice. All of Janelle's surgery was done in a minimally invasive manner. We had to make no large incisions. It was done either vaginally or through little incisions the size of my fingertip.
It was a big surgery, but my recovery period was really not bad. The pain was minimal. I was back to work within 4 weeks. It's a 6-week recovery. I just had to go back on light duty, but it went really well.
As we age, we need to remain active and healthy, and anything that gets in the way of that, we should try to address as best we can.
I'm able to exercise. I'm able to, take trips. I can go to the store without having to find a restroom. I can do just about anything without that interfering with my day. I just would want women to know that there's something else available to them than living like that every day. And they just have to start the conversation, and they need to not be ashamed of it. They don't need to be embarrassed by it. They're not the only people out there that have this. I was real lucky. I mean, to get back a sense of normalcy it's a gift, and I can't thank the people who helped me with that enough.